So when it comes to side planks, I want to start to redefine your programming approach. And what I mean is that when we think side planks, our heads ultimately go to obliques, right? You start thinking obliques. And anatomically, obliques are powerful. What I mean is we have ribs 5 through 12 for the origin. We have the insertion on the iliac crest. So we have utilization of scapulas, rib cages, and pelvises to drive air, strength, performance, all different measures. Now, the other thing that a lot of people forget about is once we're on a side, such as a side lying plank, we start to compress one side and start to expand the other. Well, ultimately, what you're going to find and what we're going to dive into is that's exactly what we need to change the structure of the patient in front of us. Once you start changing the structure, you'll then start seeing your performance indicators such as strength, range of motion, better gait patterns, better performance in the gym, better movement, less pain, all of that, because you've actually started going for the source and not the symptom. So in this video, I want to talk about how you can powerfully program a side plank for better performance, better respiration, and better movement for your patients. So when it comes down to programming your side plank, the first thing that you need to do, whether you're dealing with a side plank or whether you're dealing with any sort of exercise, is understand the intent as to why you are choosing that exercise in the first place, right? A lot of times we neglect that part and we just give our patients random exercises. But instead, I encourage you to understand the intent behind your exercise choice. Because when your intent aligns with your execution, that's when your exercise selection becomes really powerful for your patient. So the intent behind my reasoning of a left side plank that I want you to work on is to improve the structure and performance of the patient in front of you. Now, what do I mean by that? Well, we have inherent asymmetries of the body, and Postural Restoration Institute did a really good job at increasing really our whole profession's awareness of these asymmetries to not only know that they're there, but start to respect them and understand that they're there, and we can do and perform certain strategies to get the body moving better again. So that's the intent that we're shooting for with our left side plank to improve performance, respiration, structure. But before we jump into that, we need to understand what are these asymmetries in just a broad sense so that we know what we're going after. Now, we have an over-dominating right-sided pattern. And we have internal asymmetries that really contribute to that, such as a bigger diaphragm on the right side compared to the left. We have a liver, our second largest organ, our liver, on the right and not on the left. We have 3 lobes of lung on the right and 2 on the left. So we have these inherent pulling asymmetries that are pulling us into different postures and patterns, and how that's going to look on your patient is really going to depend on how patterned they truly are. But an overarching theme is that for a lot of our patients, we are going to see a pelvis on the right that is more back or in internal rotation, and a relative left rotation of the trunk. Now again, relative motion comes down to that the spine could be staying straight. So for example, if the pelvis moves right but the spine stays straight, the spine is relatively moving left even though it stays straight. Or you can have more of a compensatory factor where yes, the pelvis moves right, but we actually truly are rotating left as well, right? And you'll start to see these varying intensities of the patterns in your patients. Now, because of those structures and because of the bigger diaphragm on the right and the liver on the right, our patients tend to be more in a right shoulder down position. And accompanied with that right shoulder down, because this right pelvis is back, it's more up, right? The pelvis is kind of back and up. Now, our right shoulder is going to typically present lower in this case. What I encourage you to do is when you're in the clinic, when you're out and about, start to look at these patterns. Are people in this right-sided pattern? Typically, more often than the left, you will see that the right side is lower. So we can look at that from the front, we can look at that from behind, but the other way you can start to see this when someone's laying down and really getting a good snapshot of this when they're on the table is what's going on with this left lower rib cage, right? So a right shoulder down with a leftward spine is pretty much always going to give you this elevated, externally rotated position at your rib cage. So this is going to produce a rib flare. So you can see it when your patient is on the table. You can see if one side's coming out more than the other. You can look at it when you are checking their infrasternal angle, which we go into great detail into the Performance Redefined course. But what we are attacking with the side plank is trying to get the body in more of a reciprocal state that's not so patterned into this right side. So we're gonna strategically employ a left side plank to start to get compression on this side and get more expansion on this side. Because when you start doing that, you'll start to see range of motion and performance measures improve on your appendicular system, right? Your appendicular is gonna also be a tool to help show you what's going on at that axial skeletal system. All right, so again, our main intent is to improve performance measures by utilizing compression and expansion to get the structure in a better position. And then once we have that structure in a good position, then we can load it and then we can move it. So now that we're a bit more familiar with our asymmetries and the intent behind why we're actually prescribing this exercise in the first place, let's go into some of the key things we need to think about when it comes to programming. So the first thing when it comes to programming is that we need to ensure that we're actually setting up in a good position. We already talked about that. A lot of us are gonna have these asymmetries. So the chances are typically pretty high that we need to make some modifications when we're in a plank position, or specifically a side plank position. So the first thing we need to understand is that we typically want to perform this on the left side and not necessarily the right. Or if you want to do the right, let's double up, let's triple up on that left. Let's start to bias more of this left compression so we can get this person moving and breathing better, right? So the setup is going to be really crucial. So what I want you to do is I want you to set up on the left side. And once you're on the left side, the big first thing is that you need to start to take the load into your left shoulder blade. Too often, we set up in a position that just kills our left anterior delt, right? Our patients typically complain of left anterior pain at that shoulder or deltoid. So what we need to do is start to cue them to make sure we can get out of that left shoulder, because again, when we're in our right side bend, we tend to have a lot of elevation going on at this left shoulder. So we'll see upper left trap dominance or too much activation. So what we can start to do is drive a downward position of that left shoulder and a slightly retracted one. That's going to help get out of this anterior delt or anterior shoulder and get more into your shoulder blade, right? So step number one is really ensuring that we have our left shoulder blade engaged to make sure we're not overloading this anterior delt or long head of the biceps. Now from here, this is where we need to start to work on the opposite pattern, right? Again, the pattern of right side bend. So we are looking to be in a knees bent position, and then we are just looking to elevate the rib cage, right? So the left rib cage, we're cueing our patient to go up towards the ceiling. When we go up to the ceiling, that's going to expand the right side. It's going to compress the left side. Now, when we do that, your patients should feel their left abs turn on. Let me go back and actually say, your patients must feel their left abs turn on. So once we're in this position, we then go to our belt buckle, right? If you're familiar, an easy way to cue that slight tuck and to get out of any sort of excessive extension through that lumbar spine and pelvis is to cue them to slightly bring their belt buckle towards their chin. Once we're there, because we're on our left side, we're then going to bring the right knee slightly forward. Now, why are we doing that? We're doing that because we want to start to address the asymmetry at the pelvis, right? We said that the pelvis likes to live back compared to the spine on the right. So what we're going to do is we are going to slightly bring that forward. Now, an easy way to do this is to make sure that your patient's right knee is slightly in front of your left knee, right? If the right knee is slightly in front of their left, that's going to be an extension of their pelvis. That's showing you that they are slightly forward at that right and moving towards more of a left internal rotation bias compared to their patterned right internal rotation. All right, so once we're here, we're pretty much good to go. Your patient should feel their abs, hopefully like they've never seen before. Now, I like to cue one more time. Can we get that left rib cage up? The left rib cage up towards the ceiling, again, is going to bias more compression on the left, more expansion on the right. It's all good things that your patient needs. Now, once we're here, this is where your cues are really important. What you want to do is to cue your patient to lift their rib cage up and keep their hip low. Because what happens is too often we go into a left side plank and you go through this setup and you get the setup, and when you go to actually get that hip up, that's when people re-drop the rib cage on the left and then they compress on the right because they've lost all that they just worked to get. So really important to cue, elevate or raise your left rib cage and keep your hip low, right? So the hip will come off the ground, but we're gonna think about keeping it low so we can maintain this compressed state on the left. And then once they go up, we're gonna go as high as they can, and then they'll go back down, right? When they go down, what we want to cue is to keep the rib cage high. So at this point, you're now leading with your pelvis or your hip. So because the pelvis is lower than the rib cage, you then maintain that. So the pelvis is the main mover on the way down. The ribs are the main mover on the way up. This is all to ensure that we have a compressed rib cage here. So we're starting to address the asymmetry. Now, hopefully, that makes sense and you really understand how to kind of coach that now. And I want you to really walk away from understanding why we typically wouldn't perform it on the right, or we wouldn't perform it as many times if your goal is to improve the structure, performance, respiration, and help people get out of their patterns, right? If we do this on the right side, we start to over-dominate that pattern. They get stronger and stronger in that pattern, right? They're already good at that right side bend compressed state. So again, this is where your assessment, this is where your exercise choice really becomes specific and purposeful with your patient because you now understand why you want to do this on the left and not the right, right? And again, you'll find through other exercises you might do something on the right and not the left. It just depends on what you're going for and depends on what the structure of the patient in front of you is showing, all right? So hopefully you found that helpful. Now that you understand that, I also want to throw in just 3 simple modifications because what you're going to find is that your patient may not be able to do this position, right? Whether it's from weakness, whether it's from pain, whether it's from instability, whether it's from it's too difficult, right? As far as respiration goes, as far as performance goes. So let's go into just 3 simple modifications as far as something that's still going to give this compressed state, but might be a little easier for someone that can't go into this left side plank position. So the first modification is a unilateral farmer's walk. This is great if your patient can't tolerate the side lying position. What you want to focus here is really swinging the contralateral arm. So what your patient is getting is the compression they need on that ipsilateral side, but they're also getting that rotation that they also need on that contralateral side. So really focus swinging the arm, trying to walk as natural as possible. Another great modification for a patient who can't tolerate a side lying position is the hanging J plank. Instruct your patient to bring their ipsilateral legs up and then simply to inhale and exhale. The legs that are up is going to bias compression on that side and expansion on the contralateral side. The last modification is an isometric side plank. So we'll follow the same steps that we've talked about throughout the duration of the video. The only step that we're not doing is raising. So once we maintain our ribcage position, we can work on breathing with our arm down, our arm out in front of us, or arm above.